Good afternoon, everyone. My name is Cameron Friesen, Minister of Health, Seniors and Active Living for the province of Manitoba, and of course I'm here with Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer, for our Monday COVID-19 briefing. I just want to make the preliminary comment in order to say that we continue to focus as a province on expanding our mobile testing sites. We know that there are Manitobans who are saying that they are waiting for service at those sites. That is a concern to us because we have committed to make sure that we've got the right capabilities in our system, and that's how we keep people safe. So I can tell you that we are doubling down on our efforts to expand screening capacity, to know what the limiting factors are at this point in time. We have appointed a kind of a point person to be driving all of the government analysis. So that individual was placed in that new role last week. We know that we are undertaking this full-scale examination of our system, but I would want to be clear to Manitobans, they're not going to have to wait for the end of a full-scale examination to see improvements coming to a screening site near them. We are committing, of course, to open more sites. We are doubling the number of sites in Winnipeg over the next few weeks. In addition to that, Manitobans can know that we are looking to be very creative in how we augment the capacity that we right now have. I would want people to know that improvements are coming. As I said last week, help is on the way, but I would want people to understand that we're talking about a matter of days before they see those early improvements, and not simply a matter of weeks. And not just for Winnipeg, of course, but that the capacity augmentation coming in communities across the province, including Brandon, Southern Region, Prairie Mountain, Interlake Eastern, and Northern. So with those preliminary comments, I will put it over to Dr. Roussin to give us the daily briefing.
Thanks, Minister. Good afternoon. Yesterday, we announced a 23rd death related to COVID-19. It was a gentleman in his 50s from the Winnipeg Health Region. I can confirm that this is linked to an outbreak at Heritage Lodge Personal Care Home in Winnipeg, and extend my condolences to their friends and loved ones and family. Our current 5-day COVID-19 test positivity rate is 2.4%. 51 new cases of the virus have been identified today as of 9:30 a.m., bringing the total number of cases in Manitoba to 2,191. 12 cases today in Interlake Eastern Health Region, 1 case in Northern Health Region, 3 cases in Southern Health, and 35 cases in the Winnipeg Health Region. There are 739 active cases, 1,429 recoveries, 23 people currently in hospital, and 6 people in intensive care. Our lab testing numbers show 2,313 tests completed Friday, 2,070 tests completed Saturday, and 1,235 tests were completed on Sunday, bringing our total number of tests to 194,698. We do know that the public is frustrated with specimen collection site wait times in certain areas, and so we're certainly asking for patience at this point, but we are actively working on those solutions that's both sustainable and will evolve to their situation. Yesterday, in partnership with Chief and Council from Little Grand Rapids First Nation, we announced that multiple individuals in the community had tested positive COVID-19, and this is after attending events at the recreation center in that community from September 24 to 27. People from other First Nation communities were also present. If you attended events at the recreation center in Little Grand Rapids First Nation on those dates, please contact a nursing station or health center in your community. The public health officials are continuing to work with the community and other partners to address the situation. The community has been moved to critical, red, on the pandemic response system. Chief and Council have directed that public gatherings are not permitted and community residents are required to stay at home. People should only leave their residence to seek testing or medical care, or to send one person from a household for essential supplies. People who work in essential services are able to leave their residences for work. Non-medical masks must be worn outside of the home. IQRA school. There have been additional possible exposures at IQR school at 404 Webb Place in Winnipeg on September 22nd, 23rd, 25th, and 28th. Based on the public health investigation, there's no evidence of in-school transmission at this point, and there's no evidence that a case was acquired in the school. Public health is reaching out to close contacts and advised self-isolation, and one cohort has been moved to remote learning. Reminding everyone again that there is no cost for COVID-19 testing, even if you don't have Manitoba Health coverage. This is to ensure that everyone has access to these tests. Rapid identification of cases is paramount in our response to the pandemic. You'll certainly be asked for identification if you don't have a health card. As our demand for testing increases, we're again advising Manitobans to go for testing if you have symptoms. If you are asymptomatic, if you do not have symptoms, please do not attend for testing unless you've been advised to do so from public health. Again, we want to ensure our resources are allocated at the highest risk areas, and that's the symptomatic people. We do have updates regarding the restaurant and bar industry. We have had ongoing consultations with those sectors, and public health will be implementing the following orders to take place in the Winnipeg metropolitan region, and this is to last while the region is in orange, and they will go into force on Wednesday, October 7th. So tables and seating of at least 2 meters apart between people sitting at different tables or a non-permeable barrier will be required, and patrons are required to maintain separation at least 2 meters from other members of the public when they're not seated at the table. Seating capacity at any one table does not exceed 10 persons. Food cannot be served in a buffet style. The use of hookah and other types of water pipes continues to be prohibited. Members of the public are assigned to a table when they enter the licensed premises, and that has seating available for the entire party. Staff obtain contact information in writing from at least one person in each party and must hold on to that information for 21 days, after which it must be destroyed. Members of the public are prevented from physically moving tables or seating within that licensed premises. Members of the public are required to be seated at their table unless they're traveling to or from the washrooms, using other types of games where they can be seated and distanced, such as VLTs, and briefly interacting with staff at the licensed premises, either entering or leaving the licensed premises. We are going to be working on noise levels. We don't have a specific level at that, but we will be looking towards implementing a restriction on noise levels. No dancing will be taking place at the licensed premises. No sale or service of liquor may take place in a licensed premises between 10 p.m. and 9 a.m. The operator of the licensed premises must ensure that all members of the public vacate the licensed premises by 11 p.m. Licensed premises must be closed for dine-in service between 11 p.m. and 6 a.m., but it does not prevent food from being sold from these licensed premises after 11 p.m. for delivery or takeout. And this again will apply to the Winnipeg metropolitan region while that region is in orange. And this does not apply to liquor retail. So we're again encouraging everyone to reduce the number of contacts they have, and this includes special occasions such as our Thanksgiving holiday, which is fast approaching. make careful choices about who you choose to spend time with and limit those interactions, physical distancing, outside if possible. And again, discussing those fundamentals. We know this virus is still here. We see an increasing case numbers. We're seeing increasing cases in both hospital and ICU. Again, this is something that we expect as cases increase, but it has to remind us to get back to practicing those fundamentals which served us so well. We know that currently we have individuals hospitalized that are between the ages of 17 and 88. So we have individuals in their 20s, 30s, and 40s in the ICU. So we know that this infection can be significant, and serious outcomes occur most commonly in those at the over age 65 or with underlying health conditions, but we do see that this can affect all ages. So again, those fundamentals: stay home when you're sick, and this is vital to our success moving forward, even if you are slightly ill. Reduce the number of close contacts that you have, frequent hand hygiene, physical distancing, avoiding those enclosed places, prolonged contact, crowded places. And again, wearing a mask indoor public places. And so this not only reduces your own risk, it protects the people around you, the people you love. So we'll continue to work together on this, and visit our website, manitoba.ca/COVID-19, and can open up for some questions.
The cases on the First Nation, were these multiple events indoors at the community center, and were they following provincial guidelines in the yellow designation that was in effect?
So it was events occurring over those days that I listed. I'm not sure if it was one event or multiple events, but certainly the the amount of cases that we've identified and contacts suggests that there that it was an event that took place that put people at risk. So again, that's why we're making a public announcement of it, that people who were at those events should contact their healthcare provider.
How many people were medevaced out of that community?
I don't have that number.
But you can confirm that people were medevaced out of there.
Yeah, no, I can't confirm that. I think the best if you refer those type of specifics to FNIB, they'll probably have better answers for you.
And how are people getting the medical treatment there if they get the virus, to your knowledge?
Yeah, so I mean, most they do have access to care at their nursing station. The certainly the vast majority of people with this virus don't require specific medical care, but it is available, and then of course, if necessary, medevac would take place.
Who's responsible for enforcing the guidelines and the gathering limits in that community?
Yeah, and so right now that would be leadership in that community. As we went to restricted red, there is the option to include specific public health orders, which then could be enforced as any other public health order.
Were they following the guidelines in place at the time, the 50-person limit?
Well, I don't know the specifics on what occurred at that event. We just know that we've been reported a number of these cases connected to that event over time.
Mr. Friesen, the doubling of the test facilities in Winnipeg, the doubling will occur within 2 weeks?
Doubling will occur as soon as we can do it. The first additional site, of course, was the screening site that you saw at 1181 Portage that commenced operations last week, midweek. We should be seeing new sites in Winnipeg as early as past a week from now, perhaps a week and a half.
A week and a half before we get further, more sites than now.
Sure, but remember that new site locations will not be the only kind of investment that we are making. And so we're working hard with the regions to understand where they could pull additional workforce from, how they could facilitate elongating the hours of operation, looking for efficiencies. I understand that even the new screening site at Portage was able to go from 75 cases in a day to doing 100 tests in a day. So just like that, that newest site did 10% of all of Winnipeg's tests.
So what's the, I know you have somebody who's looking at this specifically, but what has been the main factor that's kept the province from expanding sites in Winnipeg? Is it a shortage of nurses to do the tests? So what's the one, if there's one factor, what would it be?
So there isn't one limiting factor. I had a federal, provincial, territorial meeting on Friday this last week, and other jurisdictions shared broadly, they are experiencing the same thing. It doesn't matter if you're Ontario, Quebec, Saskatchewan, Alberta, we are all faced with the same challenges that with the fall coming, there are people who are looking to get that test performed, and that systems are having to walk and chew gum at the same time. We have not that same ability to redeploy people and simply shutter the healthcare system to do it. Our hospitals are busy places these days with the surgeries, the procedures, the diagnostic testing that we have committed to bring back online. I can tell you and update you that all of the contracts that we were looking to sign at this point in time to undertake that work are now in place, and that work is continuing. So certainly, yes, to your point, workforce is a challenge, but we're trying to be creative even on that and to know, are there other trained individuals who can undertake to swab someone? Is there a cohort of individuals there where we could have some people working under the supervision of others? And we're borrowing from other provinces and being creative in our own province. All of this will be necessary to solve some complex challenges.
Nurses then?
Well, what I'd say is that nurses are doing things elsewhere in the system. I mean, we have more nurses working right now in Winnipeg than at any time before.
Shortage of nurses to do this, is that the main workforce shortage, if you will?
Well, like I said, it's a variety of factors, not just one factor.
How could it be a shortage of nurses when you only have 6 at one time at the largest of your sites swabbing?
So, like I said, it's a variety of factors, but the fact of the matter is to open new sites takes a little bit of know-how, it takes logistics. There are things like approvals from the city that are necessary. Workforce, as you say, capacity includes things like the materials and resources that we use there. And all of that work is being done behind the scenes.
Dr. Roussin, can you go over confirm the total number of cases at various First Nations? We're told 19 at Little Grand Rapids, is that correct?
That is correct as of this morning.
Tatasquiac, 1?
That's, I don't, for the most part, because we've put Little Grand Rapids on the pandemic responses, it was restricted, so I've been providing details on that. The other ones will let our partners speak to those.
Okay, so if I asked about York Factory, Sagang, Peguis, or Fisher River?
That's right, I don't have updated numbers on those, so our partners will answer that.
The bar closures in Winnipeg, obviously people gathering indoors, whether it's in Grand Rapids or in Winnipeg, the problem seems to be people gathering indoors with people outside their household in close quarters. What do you hope to achieve by, or how does closing a bar early and ending alcohol sales early reduce the risk?
It's been, what we've seen. Our cases and contacts have occurred in, later on in the evening, and I think it's, later on if there's more, alcohol being consumed, less attention to safeguards. So that's really where our EPI has pointed us right now. So that's where we're going to try to target it.
This was done in consultation with the bar, and was there any pushback from them on these, or what kind of compromises did you have to come?
Yeah, I mean, I think that From the reports of the consultation, I think that it's challenging. Obviously, these type of restrictions have big impacts on businesses, but I think there was an acknowledgement that something needed to be done, given the current state. So I think that, it's certainly a challenge for the sectors, but I think most people wanted to be part of the solution, and were, acknowledging that something had to be done.
Okay, with the community in Code Red, what are the safety measures in that community and the surrounding communities that people should be adhering to now?
Well, right now, it's masks, non-medical masks if you leave your home, so both indoor, outdoor. There's no gatherings to take place. People are required by chief and council to stay within their home and only leave for essential purposes. And those essential purposes could, certainly mean attending for health care. And essential errands should really be done by only one person of the household if possible. So real red, critical on the PRS. And we really need this in place to stop the transmission chain there.
Is it 4 weeks? Like the same?
There, for this, it doesn't have to be a set time. You're going to certainly look at certainly one incubation period for sure. If throughout that incubation period we still see new cases coming up with contacts, then we may have to extend that. But we don't really have an end date right in sight.
In terms of the care home outbreaks, I'm going to ask for updated numbers of that, as we do every time. Heritage Lodge, you announced one more death related to that, the death announced yesterday. What's the total size of that outbreak? We're told now 10 residents and 1 staff.
Yes, I have 11 total cases and one death related to that.
What's going on in that facility, to your knowledge?
Well, I think it just shows that once that virus is introduced into a setting like that, transmission is very difficult to maintain, to limit, and that's the importance of all the safeguards we have to reduce the likelihood that it's introduced.
In Parkview Place, what are we up to there now in terms of staff and residents? We know we have 3 deaths there.
Yes, so 24 confirmed cases at Parkview, which include 4 staff and 20 residents.
And Bethesda?
Let me see here. So I don't know if I have an update on Bethesda. Okay, yeah, 18, and it was. I think before we said there was 11 staff, but it's 10 staff and 8 residents.
And lastly, the John Pritchard School cluster, what is that up to now?
Yeah, so that is at 38 cases, and 10 of which are epi-linked.
I'm sorry, could you repeat that number?
38 total, 10 are epi-linked.
The new process at licensed establishments, they're going to have to get contact information from people at each table. I know it's a big ask, but they're still not being tasked with ensuring that people from different households are not sitting together, correct?
Yeah, so we did limit the amount of people at a table, so now that's the group sizes, so it can't exceed 10. So there is that protection, but no, we haven't put a burden on them to figure out who lives together and who can dine at the same table. Between tables has to be that distancing or non-permeable barrier, and then group sizes must be cannot exceed 10 at a single table.
And is there an enforcement measure for keeping that contact info? Can the business be fined if they don't?
It's going to be in the public health order, so they'll be subject to any enforcement if there's violations.
On that note, we need to go to the phones, so we're going to start with City TV and Jonas.
Good afternoon, gentlemen. Dr. Roussin, we are now a week or so into our lockdown or enhanced measures here in Winnipeg, but looking at the test results from Sunday, we had less tests conducted. We had, a lot of new cases. Are we in the area yet where we will see results, or does this tell you anything?
Well, it's still a little bit early. We're just into a week right now, and then we're even putting in more restrictions at this point to come in effect on Wednesday. So we still see cases. Right now, Winnipeg's test positivity rate is 3%. And so obviously we'll see a lot of fluctuation with that over time, but we still haven't seen a certainly not an exponential growth in the Winnipeg region. We're seeing fairly flattened numbers.
And when it comes to the ages of the folks that are either in hospital or ICU, you mentioned that briefly before, but maybe this is, the clearest indication we've had yet of the ages this is impacting in Winnipeg and the area.
That's right. And so, certainly those that are most at risk of severe outcomes are those over age 65, those with underlying medical conditions, immune compromise. But as you see more and more cases, then you'll see some of the less common outcomes. So we'll start to see younger, healthier people requiring hospitalization and even intensive care. So this virus is certainly with us for the foreseeable future. So we have to take these steps to protect everyone.
From the Brandon Sun, Kyle.
Hello, gentlemen. Dr. Roussin, I was wondering, since there are no cases in Prairie Mountain Health today, and only a couple over the past weekend, do you have anything to say to people who might who see these and might think be encouraged to drop their guard a little bit, thinking things are safe?
Yeah, and I think it's a good question, and it's kind of what a lesson we learned over the summer here, and it's one potential drawback to that targeted approach that we have. I think the target approach is the proper approach, but it does risk the interpretation that things are safe in areas that we revert back to caution. And I would say that there's a reason why they're not in green. They're in cautious. And because we're dealing with this virus going forward, and we'll be right back in orange if we lose our focus on this. So that physical distancing, the hand hygiene, the staying home when you're ill, the limiting crowded places, limiting our contacts, it has to apply everywhere. And that's what makes this virus so challenging, is we can't let our guard down, or we'll just see those numbers climb again.
Thank you. And Mr. Friesen, you mentioned that the province is looking to expand mobile testing site capabilities, like not just in the Winnipeg area, but also other health regions. Would this mean additional testing sites in places like Brandon or other parts of Prairie Mountain Health?
Yes, that is the plan.
From CJOB, Will.
Sorry, I was on mute. Good afternoon, everybody. My first question has to do with testing sites. Mr. Friesen, you mentioned earlier the province looking into expanding the workforce at these testing sites to alleviate the pressure on nurses. I'm wondering, do we have an idea at this time how many workers might be required and where exactly they're coming from?
So that's the analysis that we're undertaking right now to know what's required, but we're looking to solve these issues, and that means using creativity and availing ourselves of all the resources that are available to us. And so that's the determinations that are going on now to figure out who do we need there, how many sites will we have, and how do we constitute the workforce at each of those sites.
Okay, thanks for that. Follow-up question for Dr. Roussin. This week is going to mark 1 month since students returned to class. I'm wondering if you can just give us your thoughts on how things have gone so far, maybe aspects you're particularly pleased with or anything the system has learned in that time.
Yeah, so I think that, as expected, we saw cases in schools. We knew we see cases outside of schools, so we'll certainly see cases within schools. For the most part, we haven't seen a lot of transmission within the school, and that was the main goal with the plan. We knew that we would see asymptomatic people who are just prior to the onset of their symptoms, and so considered infectious in schools. But we really wanted to have things in place to limit the amount of transmission that occurred, and we really have seeing that in the one setting, John Pritchard, where we did see transmission. It also exemplified that the cohort method was effective as well, because we saw that transmission really occurring only in the cohort in that school. So a lot of the safeguards were working, and really going to continue to do what we can to keep the kids in school.
From the Winnipeg Sun, Scott.
Good afternoon to both of you, Scott Billick, Winnipeg Sun. I'm going to start with testing. I guess I'm still waiting, trying to get a clear answer on why the province was caught flat-footed on testing this fall. There's obviously still not enough in place. What is, like, yeah, I'm wondering why the province is in this spot.
Well, I have to be clear. I mean, why is Kitchener? Why is Edmonton? Why is Saskatoon? Why is Montreal dealing with these same issues? These are issues that are common to all provinces who have launched a very, very significant attack against COVID-19 over the case of half a year. We have workforce across this system. The same people who are asking for screening sites are also asking for their hip or knee surgery or their cataract surgery or their endoscopy procedure to be done. And we have said yes to all. And while we are clearly unsatisfied that people are waiting too long, you've got a commitment from this government that says we're redoubling our efforts. We're going to turn over every stone. We're going to find whatever it is that we can find and work cooperatively as Manitobans, as we always do, to solve this issue. So, yeah, there is a short-term pain right now, and Manitobans are feeling that. We plan to produce a long-term gain. We have said help is on the way, and I make that commitment. There is help on the way to reduce these wait times.
And my follow-up for Dr. Roussin, what kind of underlying conditions are you seeing in young people, and or are you seeing young people with underlying conditions that are in hospital or ICU?
There is a varied amount there. We do see people without any reported significant underlying condition in hospital, young people, so we do see that. And then other conditions, respiratory related conditions are common.
From CBC Radio Canada, Gavin.
Hi, Gavin from Radio Canada. Dr. Roussin, just a bit of clarity on the bar rules. Are there any specific rules about games like pool, billiards, or darts, or that sort of thing? Do you have any guidance on that front?
Yeah, that's right. So those activities won't be occurring under this order. So activities that can be taken while seated and distanced would be allowed. So that would, examples like we discussed, the VLTs, there's some, for instance, maybe arcade games like that where you could be seated and distanced. But those other type of ones where people not necessarily will be distanced or seated, they won't be occurring during this order.
With the concentrations of cases in Winnipeg, it's hunting season. People will be going out of the city to smaller communities, dumping for gas, whatever. What sort of advice do you have for people, say hunters, that will be leaving the city?
Yeah, I think it's been the same message that we've had, being COVID careful, right? So to limit your footprint, to ensure you're not traveling anywhere if you're symptomatic. Hand hygiene. I suggest wearing a mask in indoor public places, even if there isn't an order requiring it in certain areas. And then just to practice that hand hygiene, the physical distancing, avoiding crowded, tight places.
From CHVN, Taylor.
Hi, good afternoon. Minister Friesen, earlier you mentioned that the province is looking at creative solutions to deal with the testing capacity. Can you explain a little bit more what you mean by that?
Not yet. I will in a few days. Like I said, we're looking to make these investments very quickly. We want to think outside the box. We want to avail ourselves of any resource that we have. We have nurses working across our healthcare system, and if we need others to work at screening sites, we'll think long and hard about who those individuals could be. But in a matter of days, we'll be updating you again on new investments and new ways to proceed.
And for my follow-up, for the personal care home visitor pods, have they been distributed yet? Are they open for visitors?
Yes, so we're very pleased to update Manitobans and indicate that these co-visitation shelters, as you say, these pods to facilitate visits at personal care homes and to prevent that close down that we saw in spring, where residents weren't able to visit with their loved ones and caregivers. Those pods are being deployed. As a matter of fact, I believe my colleague, Minister Reg Helwer, was able to see one of these on site at Action Marguerite right here in St. Boniface in Winnipeg. I heard anecdotally that a pod had arrived, I believe, in Notre Dame de Lourdes. I'm hearing of other ones being deployed, and working with our PCH partners. They've said they're working very, very quickly to try to get them finished and then moved off the job site so that new ones can arrive. In terms of activation, there are a few things to do when they arrive on site to commission them. That work is underway, but as we've said previously, our aim is to get these things out the door as quickly as possible, commissioned on site, so they can be used for visiting.
And our final caller, Matt from CKDM.
Matt Hamill from CKDM News. My question is for Dr. Roussin. Public Health reported a case in the Dauphin Health District on Friday here in Prairie Mountain Health, bringing the district up to 8 total cases. That has now been removed from the online data, bringing our district back down to 7. Can you provide any details about why this case was taken off the list, or perhaps speak in generalities about what kind of circumstances can result in a case being taken off the list like we saw here over the weekend?
Yeah, I can't speak specifically to that, but in general terms, there's a few reasons why that happens. One is the person may not be a resident of that district. Their health card may have that address, and they may be a resident in another district, and when that's updated, then they'll be passed on to another district where they're currently residents of. Sometimes we've seen in the past false positive tests. And so that would be another reason. Sometimes we have people who are probable cases. They're symptomatic and a contact to a case that we just declare as a case pending the lab result. And if the lab result comes back negative, then sometimes they'll be removed. So there's a few instances where we see that.
I see. And as a follow-up, I just want to be clear, these new public health orders for restaurants and the food industry, is this a province-wide measure or targeted for just the Winnipeg region?
That's right, just the Winnipeg capital region while they're in orange.
And thank you. We now return to room 68 for the final minute or two of questions.
Dr. Roussin, the man who died at Heritage Lodge in his 50s, did he have underlying conditions?
Yes.
Can you elaborate at all on them?
Multiple underlying medical conditions that would put you at significant risk for severe outcomes with COVID.
The pandemic has changed our language. Words like lockdown and coronavirus we're using more often. So we're wondering how you feel about the words that you're using and the messages that you're using at press conferences like this are becoming a part of normal vocabulary. How do you feel about that?
Well, I mean, I think that's, these are these challenging times, and so I'll throw one of those out, the new normal, right? And so this is our new normal, and for the foreseeable future, we're going to be changing the ways that we do things. So I think that there's going to be a lot of vocabulary, a lot of actions, a lot of advice that's just becoming the norm. And a lot of it may not ever return to pre-COVID levels, some of the precautions that we take.
I might have missed this earlier, but of the cases, the 19 cases in Little Grand Rapids, can you say how many are in hospital?
No, I don't have that info.
And of those cases, can you say how many are residents of Little Grand Rapids?
I believe all of them are from that community. That's, yeah.
And just getting back to the bar screening, you talked the sound regulations aren't ready yet. Would you be giving all the bars a decibel meter or recommending a decibel meter app on a phone to use in that instance?
Yeah, from what I hear, there's an easily downloaded app that can give you that information. And it just from our jurisdiction and other jurisdictions, we see that the loud places means louder talking, closer talking, so just puts increased risk.
So you're trying to settle on a decibel?
Yeah, that's right. We want to be as objective as we can so people know exactly what they need to do.
So for my sound days, decibel is very, it can be very relative to the number of people in the room as opposed to the recorded music. So what sort of, would it be the, forgive me on this, would it be the ambient decibel rating at a single point, an average, or what are you looking at?
Yeah, I think that, what would happen, and most of our orders are like this, right, is that we would provide education and support first. So I think that if an inspector came in and it was above the decibel limit within reason, the advice would be that you're exceeding it and need to put in measures to reduce it.
Speaking of inspections, how is this new regime for restaurants, bars going to be enforced?
Yep, so it's the same as any other public health order. So public health inspectors would be able to do this. Liquor, Gaming, Cannabis Authority inspectors as well will be involved.
When's the order being published, or?
I'll sign that on Wednesday at noon, and it'll come into force at 6 p.m. on Wednesday.
That's when we'll be able to see it.
Yes.
Yeah, and when will it actually be in force at that time? We've had reports of some members of cabinet running around saying the media failed to tell people last Monday that things actually weren't enforced until later in the day when we were saying at 12 in the morning. So we want to get this right this time if you guys are going to accuse us of doing the wrong thing.
Yeah, so those we plan to sign the orders at around noon, and they will come into force about 6 p.m. on Wednesday.
What's the feedback or uptake you've seen with the COVID app? I know it's very confidential, but do you know if any Manitobans are using it to report being positive, or how many people are using it?
So I don't have any update on that on how many have downloaded it all. It's a voluntary app and requires a number of steps, and I'd encourage all Manitobans to download it. It's a voluntary download. When somebody who is tested positive, they'll be contacted by public health as per usual. They will be offered a code to type into that app. That code will then notify contacts through that manner, and public health is not aware of any of the contacts. That no list of contacts is sent to public health. Only the people who are been contacted are notified and provided direction.
More?
The changes for the screening of children that you spoke about last week, when would they come in?
We're actually just finalizing that in the upcoming days, and so hopefully we'll have. It's not just regarding children. It'll be regarding our screening tool advice to Manitobans. So that should be updated in probably within the upcoming week or so.
Okay, one last little picky one here. College Louis Riel. There was what did it take from September 28th to October 4th to advise the school of that case?
Well, I don't know the specifics of that, so remember that, we can't advise a school until we have a positive result. So there could have been a delay in testing. And so as soon as we're notified of it and we do our contact investigation or case investigation, then we'll notify the school. So if somebody was, we didn't get a positive result for days after they were infectious, then that's the most common reason why there's a delay.
About the expanded testing, you're doubling the number of sites. What does that mean for overall capacity? Are each one of these sites going to be doing the same number of tests that all the other sites are doing? Do you know?
We want as much capacity as possible. So, we even saw in the last couple of days that the site at 1181 Portage was able to do now 100 a day tests. So we know that we're looking at some very broad new sites. I can't give away too much yet because we have agreements that aren't yet signed, but we're looking at some very significant expansion of capacity in order to facilitate that larger number of tests that we're seeing we want to do.
And just to follow up to that quick, what about the lab capacity? If we're doing this many more tests, are we going to be able to process it in the same 24 to 48 hour time period that we've been doing?
That's, so certainly we have that capacity right now for 3,000 lab tests, and then there can be, some surge ability on there. And then we're still working on, different platforms, different approaches to even increase that nature of the capacity.
3,000 on a sustained basis?
That's what we have right now. If the reagent supplies and things stay the same, then yes.
Thank you for answering all of our questions.